Good morning and welcome to Radio Doctor. Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on Your Women Radio. Radio Doctor is broadcast from 10 a.m. Mondays through to Fridays. My name is Miracle Phillip, and our Radio Doctor for today is Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. Good morning to you, Dr. Abiola. How are you today?
I'm doing great. And you?
I'm doing great too. Glad to have you on this week's edition of Radio Doctor today.
Thank you.
On Radio Doctor today, Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital, will be consulting and advising on premature ejaculation and erectile dysfunction. The phone lines will be open for you to get to ask your questions, and the lines are 07000 917 917. Our toll-free number for women to get to call in 0800 1235 917, and we have our SMS and WhatsApp line that is 0703 175 6537. Don't forget to follow us across all socials at Wfm 91.7 on Facebook, on X, on Instagram, on YouTube, and also listen to us live from wherever you are around the world via our website www.wfm917.com. So we'll get into the discuss this morning with Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. All right, doctor. As a medical practitioner, what is premature ejaculation and how does it differ from erectile dysfunction?
Yeah, thanks for having me. This topic, premature ejaculation and erectile dysfunction, is important because it affects so many men. You know, I like to introduce some statistics early on. In the U.S., you know, they're better at taking surveys. So anywhere from 20 to 30% of men will suffer from premature ejaculation at some point. That's about 30 million men. We use those same numbers in Nigeria to about 30, anywhere from 20 to 60 million men. So this is something that can affect anybody. The definition of premature ejaculation is just when an ejaculation that occurs too quickly during penetrative intercourse, and usually it's between 1 to 2 minutes, but the most defining characteristic is that it's before the person wants it, before the partner is satisfied. So it could be lifelong or it could be acquired, but it differs from erectile dysfunction, where erectile dysfunction is the consistent inability to achieve or maintain an erection sufficient for sexual activity. So just because somebody has premature ejaculation doesn't mean they have to have erectile dysfunction and vice versa. The two are different, but oftentimes you find both of them in the same man.
All right. So what now are the common causes of premature ejaculation in men?
The cause is not just one. Cause is usually what we call multifactorial, which means it involves psychological, biological, and even relationship factors, meaning how your relationship is between you and your partner. The psychological causes can include things like anxiety or performance anxiety, stress, even unresolved sexual trauma can be a part of it. Biologically, we know that premature ejaculation is associated with abnormal neurotransmitter levels. These are chemicals in your brain that help control our body. One of them is serotonin. Serotonin controls our sleep patterns, our happiness, our mood, our thoughts, as well as it plays a large role in premature ejaculation. And then some people may have heightened sensitivity in their penis, and the rest of them, some people may have a genetic predisposition to premature ejaculation. In Nigeria, a lot of it sometimes centers around social, cultural pressures, where male performance the pressure for male performance can make performance anxiety worse, making premature ejaculation more common. And of course, it's in men. We think somewhere around 30% of men report having this issue at some point in their lives. Statistics show that 50% of men by the age of 50, over 50% of men by the age of 50 would have experienced premature ejaculation. So this is not something that needs to hide in the shadows. We need to go ahead and admit it, because the sooner we admit it, the sooner we can find the cause and hopefully the treatment.
Thank you very much, Dr. Abiola, for giving that, sharing the causes of premature ejaculation in men. There was a particular point you made mention of. You made mention of trauma. When you're talking about sexual trauma, are you talking about rape?
That's sexual assault, rape.
Okay.
Yes, and any on the spectrum. These things, whether they're in the front of your mind or subconsciously, affect how we interact sexually with our partner. And one of the consequences could be erectile dysfunction and premature ejaculation. Both are associated.
All right. Thank you very much, Dr. Abiola. Well, if you've just tuned in, this is Women Radio 91.7, Nigeria's first and only radio station for women and their families. And it is Radio Doctor, your free health consultation program where real doctors advise real people. It is Nigeria's first specialized health program where medical doctors consult for free and advise on your Women Radio 91.7. And our radio doctor today is Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. He is consulting and advising on premature ejaculation and erectile dysfunction. Dr. Abiola, how prevalent is erectile dysfunction among men of different age groups?
Our studies in Nigeria are a little bit less formal, but there's some regional studies that I looked up before coming on. It shows that about 40% of men over the age of 40 in Nigeria will have erectile dysfunction. And there was a study done in Lagos. There was another study done in Kano. And both of them came up with about the same numbers, that 40% at age 40, almost 50% at age 50 had different degrees of erectile dysfunction. In the U.S., they have a lot better statistics. There was a study showing that 2% of men between the ages of 40 and 70 will experience some degree of erectile dysfunction, and about 40% of men by age 40, and about 70% of men by age 70. So this is a very common, let's call it disorder. It can affect anybody, and it's not something that has to be it's not a permanent diagnosis. For example, if I diagnose you with high blood pressure at age 50, more than likely you're going to have it for life. Right? But just because we diagnose you with erectile dysfunction at age 50 doesn't mean you have to have it for life. But it affects the majority of men.
All right. Thank you very much for that clarity right there. I know we made mention of, we talked about the causes. I would like us to even go deeper into some of these causes, looking at them in the different aspects. Now, can psychological factors contribute to both premature ejaculation and erectile dysfunction?
The short answer is yes. And, the intro for Radio Doctor on Fridays is actually my voice, one of the introduction, and I'm talking about that if you're having problems with your fiancé, your girlfriend, or your wife, lead to erectile dysfunction. I'm so used to hearing it, I think you've heard it. Yes. And it's still true. Psychological factors play a very significant role in both premature ejaculation and erectile dysfunction. Things like anxiety, things like depression, low self-esteem, and relationship issues. If arguing with your significant other, it's going to be hard to get into the mood for sex. And what I see in the practice, like people that are trying to have a child, or struggling with infertility, for them to meet often enough, tell them to meet at least three times a week. For them to meet often enough, we oftentimes have to dive into this aspect, make sure that the two of them are psychologically steady and psychologically compatible at that moment to engage that frequency. So, and then another form of anxiety, or performance anxiety in particular, it triggers a psychological cycle. So you have the cycle where you have a fear of failure, and then vascular failure brings on the premature ejaculation, and it feeds into depression, and then that can now even generate erectile dysfunction because you're afraid of prematurely ejaculating. You now have troubles with erectile dysfunction, and the cycle continues because it's self-reinforcing. So in the U.S., we've estimated about 10 to 20% of ED or erectile dysfunction has a psychological origin. So it's a significant chunk of it as a cause.
All right. Thank you very much, Dr. Abiola. If you do have any questions you'd like to ask Dr. Abiola on this note, premature ejaculation and erectile dysfunction, you can do well to reach us via our phone lines 07000 917 917, our toll-free number as well. For women, 0800 1235 917, and also our SMS and WhatsApp line, that's 0703 175 6537. So those are the phone lines for you to get to engage us this morning on this conversation. We have Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital, who will be consulting and advising on premature ejaculation and erectile dysfunction. All right, Dr. Abiola, what are some physical health conditions that can lead to erectile dysfunction?
Yeah, some of them, some of these medical conditions include cardiovascular disease, heart disease, diabetes, high blood pressure, high cholesterol, and obesity. And if I have a man in front of me that says, I didn't mention, even though 50% of men will suffer from this, only about 9% of men will actually say something to their doctor about it. And usually by the time they've said something to their doctor, they've tried 5 different, we call them internet and home remedies, right? But there may be some ED or erectile dysfunction may be the sign of something else happening. I had this happen to a patient a few days ago. He came in complaining about erectile dysfunction. And the first thing I'm going to check for is high blood pressure. The second thing I'm going to check for is diabetes. And we found that his blood sugar was creeping upwards. He was in the pre-diabetic range. And I want to emphasize that it's the erectile dysfunction that got him into the office. Perfect, fine. But we now discovered that he is pre-diabetic. A pre-diabetic you can treat with diet and exercise and lifestyle changes and extend that period, but keep them from actually developing diabetes, as opposed to if he waited, ignored the erectile dysfunction, by the time he came into the hospital, it would be a full-blown diabetic, and the treatment would be a lot harder for him. So it's usually a sign of what we call microvascular disease or small vessel disease, and high blood pressure, diabetes, and things like that.
Wow, pretty interesting though, to even think that some health conditions could actually really affect a man's productivity in that light. And I'm glad that you're bringing this forward and even sharing this so that, a lot of men can also be well aware. Now, let's also look at lifestyle choices like diet, exercise. Can this impact on their sexual health?
Yes, 100%. Diet and exercise are very critical for maintaining sexual health. This is something you'll hear me talk about consistently in any topic, the relationship of your diet or your nutrition status and exercise on the disease process. So we know that diet, not starving yourself of calories, but changing what you eat. A proper diet, proper exercise improves high blood pressure, it improves diabetes and blood sugar control, improves your cholesterol. Exercise increases HDL, which is the good cholesterol, and goes around taking up bad cholesterol. It improves obesity, and it improves cardiovascular disease. Now, all those 5 things, those are the physical health conditions that contribute to erectile dysfunction. Notice how all of them are improved by improving your diet and improving your exercise. And we said it briefly on the last program or so. When I'm talking about exercise, people may start rolling their eyes, I don't have time to go to the gym.
Okay.
I don't have the money for membership. That is not that exercise is fantastic. Go to the gym if you can, but you can do exercise that's worthy, that it can help you with these diseases in your bedroom or in your office even. Squats, body weight squats, 20 of them. Let your butt touch the chair and stand up again. 20 of those, 20 jumping jacks a day, even just 3 times a week. Guess what? Even just once a week will give you benefits. The 7 minutes a week will give you benefits. I have research that shows it. The more you do, up to a point, the more the benefits. But I don't know anybody that cannot find 7 minutes a week to do some exercise in their bedroom. And over time, all the diseases get better. Erectile dysfunction gets better. High blood pressure gets better. High cholesterol gets better. I'm not saying that's the cure, but it can definitely improve the situation and possibly reduce your dependence on medication and other treatments.
Well, okay, go ahead.
So go ahead. The other side effect, or positive side effect of exercise, is that it reduces stress. We're all stressed in this environment, and we know that stress and psychological stress can affect this, but all of it helps. Those in the U.S. exercise regularly are 30% less likely to develop erectile dysfunction.
I like how you brought in the place of, having to simplify this thing, because just like you said, when people hear exercise, they're thinking, oh, I don't have time to exercise. Oh, I'm always so busy. Oh, I have to rush out of work. I have to go to bed. I have other work that I have to do. But 7 minutes in a week, I think that's even so small, but it just is to say that little effort in exercising can, be a lot more impactful in one's health, and then now sexual health as well. I was just going to bring it in before you actually brought in the fact that you could simplify this exercise. I thought to ask, do men need to maybe seek some professional help, medical help in the sense of what diet to take, what exercises also to engage in?
Yes, it's helpful, but am I going to say you've got to see your doctor before you do 20 body weight squats and 20 jumping jacks? Most everybody should be able to do that. If you have a medical condition like a slip disc in your back, or you've had back surgery, or you have anything, or issue with your legs, please see your doctor first. Make sure that you're capable of doing it. But pretty much everybody should be able to tolerate that, and you just have to start. You cannot wish better health. You cannot wish better muscles. You cannot wish less fat. You have to do something. You have to get moving. And that 7 minutes a week will give you results. Imagine if you did 7 minutes 3 times a week. After a month, 4 to 6 weeks, even you look in the mirror like, wow, I look better. My skin looks better. My body feels better. You're sleeping better. Everything is improved with even that minimal amount of effort.
All right. Thank you very much, Dr. Abiola. And I do hope that, men have taken note of this to engage exercising as much as possible. I know some people say, oh, Miracle, I used to walk. I used to do this one, and that should make up. But you have to be very intentional about this.
I'm happy you said that. No, that doesn't make up. Right? So, for body, when we exercise, what are we really trying to do? We're sending signals to our muscles to grow, to take on more stress, to burn calories, nutrients, right? So you have to give it the signal, and the signal comes from the exercise. When you're walking, these are normal functions, right? So your body is not giving the signal to grow and to secrete growth hormone and secrete all these hormones. But when you dedicate some time to do some exercises, you get those signals. So it's important thing that you mentioned.
All right. Thank you very much, Dr. Abiola. Are there any specific medications that can cause erectile dysfunction?
Yes, a lot. And since you asked for specifics, I won't name names because we'll be here for all day, but I'll name the categories, right? And people that are taking antihypertensives or BP medication, blood pressure medication, very high. People taking antidepressants, very high. Anybody that's taking, I see a lot of patients with prostate disease and prostate cancer. Prostate medications can contribute to erectile dysfunction. In the States, about 25% of all erectile dysfunction cases can be linked to side effects of medication. In Nigeria, a study was done that a third of men that were on a drug called a beta blocker, which is meant for blood pressure, a third of them report some degree of ED. So it's important to monitor and manage those side effects. I had a patient that has been on high blood pressure medication for a long time, started experiencing erectile dysfunction. We were able to change some of his medications to different BP drugs that had less of that, and it improved his erectile dysfunction. So don't be quiet about it. Speak up to it, and make sure your doctor, I call it running the list. Take your whole list of medications and go through them one by one to see if any of them can contribute. But yes, it's very common.
Wow. Thank you very much, Doctor, for sharing this with us. I mean, it now means that a lot of men need to be very observant when they are taking medication so that they are able to report these slight changes to their doctors as much as possible. Doctor, do you think that there are cases where, two individuals can say, oh, I'm taking this medication, but I'm not feeling this way, I'm not having that sign, and then the other person is having the reaction?
Oh, that's a very good point. That's a very, very good point. The answer to that is yes. So I can use a drug, let's call it drug X. If I use drug X in patient 1 and patient 2, both of them may and usually experience different effects, different side effects. Everybody's genetic makeup is different, and so they're going to respond to medication differently. So yeah, somebody could be on that same drug for 10 years and not experience erectile dysfunction, and you can use it for 3 months and start experiencing it. It's definitely possible. So it's always good to bring up changes and things that you notice to your doctor.
All right, thank you very much, Dr. Abiola. If you've just tuned in, this is Women Radio 91.7, Nigeria's first and only radio station for women and their families. It is Radio Doctor, your free health consultation program where real doctors advise real people. And we have with us Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. He is consulting and advising on premature ejaculation and erectile dysfunction. Don't forget that if you do have any questions you want Dr. Abiola to address, the phone lines are 07000 917 917, our toll-free number for women 0800 1235 917, and our SMS and WhatsApp line 0703 175 6537. Okay, there's a message here coming from Mike. It says, good morning, my name is Mike. Please ask the doctor, what should a man who was diagnosed to have azoospermia do, having done surgery as advertised to a urologist, and drugs have been given, yet there has been no conception despite the woman being okay. The man is very sexually active. What should he do?
That's an excellent question for urology, and that's what we practice at ROA all day, all night. It's almost like, there's some details that aren't there, but azoospermia is lack of sperm in your semen. So when you ejaculate, you have semen and you have sperm. Sperm has your DNA. Semen is just the fluid, that whitish fluid that protects the sperm and nourishes the sperm and lubricates the canal. So in that ejaculate, no sperm. Azoospermia means zero sperm. And sometimes it can be caused by hormonal issues, and sometimes it can be caused by, I used to say, mechanical issues. There's tubes that are supposed to carry the sperm, and sometimes you can have blockages in those tubes. You can have something called a varicocele, where you have a dilated blood vessel. It sounds like he had surgery for one of those things. And hopefully, I don't know how long the surgery was, but you'd expect, hopefully within 3 to 4 months, you'd start seeing sperm. What I would do for him is, or somebody in this category, is like, I want to know, is his azoospermia or lack of sperm because there's no sperm in the testicle? So typically what I do for these people, I do a testicular biopsy. Go to the testicle, take a sample, and see if there's any sperm there. If there's no sperm in the testicle, then we may have serious issues and check hormone levels. And so if there's sperm there, I want to see what quality of sperm. Are they immature or mature? Sometimes we have an issue there. If your surgery is not able to correct the flow, but you still have sperm in the testicle, you can still get someone pregnant through things like ICSI and IVF. So all hope is not lost. I think that person maybe should contact me off there to get the specifics.
All right. Thank you very much, Dr. Abiola. Mike, I think you'd have to contact him directly, but don't worry. You could stay through to the end of the program, and we'll also put out Dr. Abiola's number and details for you to follow him through and get very specific, attention to this case. Thank you so much for asking your question. The phone lines are still open, 07000 917 917. Our toll-free number for women, 0800 1235 917, and our SMS and WhatsApp line, 0703 175 6537. Dr. Abiola is consulting and advising on premature ejaculation and erectile dysfunction. He is the MD and CEO of ROA Specialist Hospital. Now, Dr. Abiola, I would like for us to look at this part of the discussion that I know you highlighted it previously, the role that stress and anxiety plays in premature ejaculation. It's almost difficult for anyone to really avoid stress in this day and time. But now it's the extreme levels to which this now affects a man's productive health or reproductive health.
Yeah, the role of stress and anxiety is major. They're major contributors to premature ejaculation. Stress and anxiety, or men under chronic stress can find it very difficult to control ejaculation because your nervous system is heightened. So ejaculation is a reflex. It's a nervous reflex, like sneezing even. So you have the ejaculatory center in your spinal cord, and in response to friction, you now get a release. That release may be faster, premature ejaculation, when you're heightened nervous activity, meaning you're under constant stress. Feeling nervous and being stressed produces almost the same result in the body. Some hormones, stress hormones are released, your cells become extra sensitive, your nerves become extra sensitive, and because of all that, you can now go through premature ejaculation. In the studies, we show that about 40% of men that suffer from premature ejaculation also have high levels of stress or anxiety. So that's almost half. And you mentioned that it's hard to avoid stress. For example, if I say my stress is coming from my job or my commute to my job and I can't change my job, you have to now find ways to manage your stress better. So even if the stressful situation isn't changed, your response to stress needs to change. And you can do that through so many different things. Maybe we'll have a topic on that. Something called biofeedback, psychological counseling, meditation works fantastically, yoga, those kind of things can help manage your stress response and treat this. 40% of men have some degree of chronic stress when they have premature ejaculation.
All right. Thank you very much, Dr. Abiola. Now, how can men effectively communicate with their partners about these issues? Because, we've seen over time that it's so easy for the entire conversation around reproduction, and I know you mentioned this some episodes ago, to always be the blame always passed on the woman. Oh, she's the one, she's not getting pregnant and all of that. And I know that sometimes men could actually realize that they have these issues, but they're so scared or so feeling like their ego is going to be broken if they open up to their partner and be like, I'm the one, this is the issue. How can they effectively communicate with their partners about these things?
Unfortunately, cultural barriers in Nigeria make these conversations difficult. But it's crucial to overcome the stigma around these issues. The communication has to involve openness, honesty, and sensitivity. When you're talking about erectile dysfunction or premature ejaculation, your partners can see it, right? Your partner is there, and I know it instantly the man will feel shame, maybe depressed over time. That's part of it. But the sooner that both of you look at each other and say, hey, this is an issue, let's talk about it. Are you also concerned? Yes, if we're both concerned, let's do something about it. We educate ourselves with programs like this. We seek proper healthcare professionals that can not just look at your blood pressure, not just look at your blood sugar, but they can also look at your psychological status, talk to you about socioeconomic stressors, all those things. But it starts with the conversation between you and your partner. The thing we like to do here is if we do not say the problem, we think that the problem is going to disappear. That's a Nigerian thing. I've seen it all over. And that is just not true. Speaking the problem does not make it worse, does not bring it to the forefront, does not bring it out. It just allows us to be more comfortable in talking about it. And at times, somebody with erectile dysfunction or premature ejaculation that has it due to psychological issues, just talking about it and seeing that your partner is willing to talk about it, the partner is willing to support you, willing to listen, even that alone can improve the situation before you even get to the doctor. So it's important, and I think the more we have these conversations out in the open, the more comfortable men will start feeling about being open, bringing it to the front.
All right. Thank you very much, Dr. Abiola. And I know that we would have to also speak to the women as well. What would you say to the women who, have husbands who are having to deal with this, especially realizing that, it's something that's not, it's not my issue now, it's his issue. I know that sometimes the reactions can be very devastating in some sense that maybe the woman has borne it all the while and then realizing that, everything she's had to go through, it's actually him. What would you say to such women?
I would plead for them to be understanding and to try and not make their man feel bad and say it. If the man hasn't brought it up first, if you can gently bring it up, like, hey, I want to just talk to you about this premature ejaculation. And you may not use that term, but I don't want to use street terms. You or your erectile dysfunction. Let's talk about it. Do you know what's going on? Are you stressed? Is there anything that I can do? The woman needs to know, and the man needs to know that there is hope. This is not something that you're supposed to suffer. A lot of times men have a problem and you just try to bottle it up and keep it inside and just figure it out. At times you need help to figure it out. And at times there may be things that you can't see. Once that conversation has been had, you can now start working on the treatments. And the treatments may be just as simple as coming in to talk to your doctor. Very, very simple.
All right. Thank you very much, Dr. Abiola. I'm sure a lot of men have taken note of this morning, even though I know some people are going to be like, Miracle, if you know the kind of spouse I have. But that's why we even bring in this forward so that, doctor can advise you on what you should do. 20 minutes now. Okay.
Program for you. I'm just saying you can play the program for your partner. You just need to break the ice and then be able to talk about it openly. I've opened up a YouTube video for a couple where the YouTube video was talking about erectile dysfunction. There's a 3-minute video, and that was enough to break that. Yeah, I do get those kind of feelings. But yeah, that happens from time to time. Fantastic. We can now start talking.
Beautiful, very beautiful. I think couples need to even continue to remind themselves that this thing is a partnership that they have to go through together. Yeah, it's him or her, but both of you can go through it together. You are one in this. All right, 20 minutes to 11 on Your Women Radio 91.7, and it is Radio Doctor. We have Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital, who is consulting and advising on premature ejaculation and erectile dysfunction. You can do well to send in your questions via SMS and WhatsApp line 0703-175-6537, and we have our phone line for women, and that is for women 0800-1235-917, but the general line is 07000 917-917. Dr. Abiola, what role does hormonal imbalances play in erectile dysfunction?
Yeah, hormonal imbalances, in the medical community we call it hypogonadism, and then it's particularly low testosterone can lead to erectile dysfunction. Testosterone, or the male hormone, is essential for libido. That's the interest in sex. So low levels of testosterone can reduce sexual desire and make it difficult to achieve or maintain an erection. Your question was asking about hormonal imbalances. Testosterone is that hormone. From the age of 30, most men's testosterone levels start declining by 1 to 2% a year. And about 5% of men will have clinically low testosterone by the age of 30. And notice that it gets worse, or your testosterone levels naturally decline over time. So this is something that can happen to anybody. The testosterone level decline is part of the human experience, but you do not have to continue to suffer with erectile dysfunction. If we know that testosterone levels are low, we can actually do things to boost testosterone, sometimes through diet, sometimes through supplements, and sometimes through directly giving the patient testosterone in one form or another. I want to make a plea that no one should start testosterone therapy without seeing at least their doctor or the urologist to make sure that you don't have any prostate disease, because testosterone treatment can worsen prostate disease and prostate cancer. But if you don't have that, then something called testosterone replacement therapy is becoming much more common among men that have hypogonadism and erectile dysfunction.
All right. Now, doctor, how can erectile dysfunction be diagnosed? Before I get to that, what treatment options are actually available for premature ejaculation?
We have a lot of treatment options. Remember, we talked about the different causes of premature ejaculation. So some of the treatment options are going to include behavioral techniques, things that are going to go ahead. Oh, I thought you wanted to say something.
Okay, no, not at all. I was listening to you.
Oh, so some of the treatment options are going to include looking at those underlying psychological issues.
Okay.
That's why I said it's good to have a comprehensive discussion with your doctor. If you have underlying depression or anxiety, we need to treat that, right? And at times, the medication that we use to treat the underlying depression or anxiety can improve premature ejaculation in specific, especially when you have issues with serotonin. There are some behavioral techniques, something called the stop-start method, and I can describe it. As you're having intercourse, when you get close to ejaculating, you stop. Your partner squeezes your penis hard enough so that erection goes down a little or somewhat, and then you do that probably 3 times that session. You do it up to 3 times in a week, and over time, this is shown 80% of people that do this over time have shown they can almost double their ejaculation window. And this is something you can just do with your partner at home. It doesn't require medications or anything else. They even have sprays. They're called topical anesthetics, where it can reduce sensitivity if that's the number one issue. We have medications, many different medications that we can use. I use them here, and almost everybody that I put on the medications, within 5 to 10 days, will start feeling the results, and up to 3 weeks of using it once a day medication, you will now see the maximum benefits. But plenty of treatment options centered around medication and behavioral approaches like the stop-start.
Okay. All right. Thank you very much, Dr. Abiola. And I do hope that, the men have taken note of this. Also, for diagnosis, how can it be diagnosed by a healthcare professional? I'm talking about erectile dysfunction.
Yeah, erectile dysfunction is somewhat of a clinical diagnosis. As we're talking, I ask the question, are you satisfied with your erections? If the person says no, they automatically have erectile dysfunction to me. If I ask, is your erection suitable for penetration, they say no, they automatically have erectile dysfunction to me and to most urologists. So, but you take a careful combination of patient history, physical exam, and some lab tests. And when we're doing lab tests, there's no lab test for erectile dysfunction, right? But there's lab tests for low testosterone, for diabetes. We can check for high blood pressure. We can check for heart disease. All of those tests will identify underlying causes and contribute to treatment. of erectile dysfunction.
All right. If you've just tuned in, this is Radio Doctor on Your Women Radio 91.7, Nigeria's first and only radio station for women and their families. And it is Radio Doctor, your free health consultation program where real doctors advise real people. We have with us Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital, who is consulting and advising on premature ejaculation and erectile dysfunction. Dr. Abiola, are there any natural remedies or therapies that may help with these conditions?
Yeah, there are a few. We know that erectile dysfunction can be improved by increasing something called nitric oxide. Nitric oxide is a compound that helps vasodilate or relax blood vessels. So there's some natural things that increase nitric oxide. One of them is called citrulline. Another one is called L-arginine. Even ginseng has shown some activity. The other natural remedies, lifestyle changes, meaning reduce alcohol, stop smoking, then starting your exercise program. All of them have very good potential in treating erectile dysfunction and premature ejaculation. But the effectiveness is variable because of people's variable effort levels. But some of those ones, I'll mention them again: L-arginine, citrulline, ginseng, lifestyle changes, and as well as exercise. And there's some people that you can treat completely with just lifestyle modifications and maybe supplements. There's another supplement people may have heard of, Yohimbi. It's neither here nor there. Some people say it works. Some people say it doesn't work. We've been using it to treat erectile dysfunction for decades, so it's another one of them. That's there.
All right. Thank you very much, Dr. Abiola. I also want to bring this back again. The advice that you'd give to men who are more than just embarrassed to share this with their wives, but also to seek help for these issues. You hear conversations of, God forbid, that's not me. It's not happening to me. That's not the case. I'll be fine. It's just there. What would you say to them?
I would say that men should understand that sexual dysfunction, like premature ejaculation and erectile dysfunction, are common. We said 40% by 40, 52% by 50, 70% by 70 are going to experience one of these. So avoiding treatment due to embarrassment or embarrassment, as we say, due to embarrassment can worsen your condition over time. We used an example of the pre-diabetic and diabetic earlier, but if you have an erectile dysfunction or even premature ejaculation, it could be a sign of an underlying condition that is just starting, maybe the beginning of diabetes or pre-diabetes, maybe early hypertension or early high blood pressure. So avoiding treatment for your erectile dysfunction may lead to not only your erectile dysfunction getting worse over time, but your diabetes getting worse or your high blood pressure getting worse. It's always better to seek help early. It's going to lead to better outcomes and easier treatment options.
Always seek help on time and as early as possible. And just like Dr. Abiola has said, I think one must also be very observant with their bodies as well to notice what changes are there and not just hide it under the cupboard. You'll be fine. You will. So, Dr. Abiola, okay. You want to say something?
I like to encourage men when you're seeking, and women too, when you're seeking medical advice, look at it as a positive step towards improving your quality of life. Don't look at it like, I got to go to the doctor now to find something. I'm going to spend money or I'm going to be taking drugs. Look at it as a chance to improve your quality of life. And being a doctor like me, I'm going to take you through what's your stressor, what's your diet like, what's your exercise like, what's your sleep like, what kind of stress do you have at work or at home. All those things are important before we now start doing a myriad of blood tests. So just be encouraged that it's a way to improve your quality of life, not a way to burden you with more problems.
Thank you very much, Doctor. And your last line also, it speaks to when we also say that people need to go for regular checkup, not because you're going to be downloaded with a range of diseases, but because you're actually trying to improve your health and know more about your body. That helps too. Okay, Doctor, as we conclude, how can education and awareness help reduce the stigma surrounding these sexual health conditions? We see that I'm grateful for what we do at Women Radio and also having you join us on Friday, and that's a lot, and that's something I appreciate you for. We see people propagating very bad information online, making people so scared. They almost do not know what is right from wrong concerning treating sexually related issues.
Yeah, so people be especially as social media, the internet is growing exponentially every day. Be careful of where you get your information from. Not everybody on YouTube that calls themselves a doctor really knows what they're talking about. Not everybody on YouTube. I've seen outlandish things where people say, "Oh, go and drink this, go and mix this with that." Just be very careful about where you get information. And I wouldn't start doing something that I saw on even something I heard on the radio from somebody like me. I wouldn't start that without seeking proper counsel and making sure that it is right for you. Education and awareness play a very crucial role in reducing the stigma around sexual dysfunctions. And this program, what we're doing, helps dispel the myths, and we'll provide an accurate information to try and help men understand that premature ejaculation, erectile dysfunction, these are common problems. They have treatment. You do not have to be embarrassed. Open discussions, whether on the air or in your healthcare provider's office, all those discussions are the key to normalizing these issues. That's the best thing I can say.
All right. Thank you very, very much, Dr. Abiola Ajayi, MD of ROA Specialist Hospital, for today's free consultation and advice on premature ejaculation and erectile dysfunction.
My pleasure. Cheers.
Dr. Abiola is the MD and CEO of ROA Specialist Hospital. For consultation, you might want to grab a pen and a paper to get this one so you can reach Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital, on 0913 579 5108. I repeat, 0913 579 5108. You can also reach out to this line for an appointment and direction, and it's this 0816 601 4901. 0816 601 4901. That's for an appointment and directions. And Dr. Abiola, you want to share your social media handles?
Please, you guys can visit us at ROA Specialist Hospital on all the social medias that matter. That's Twitter, Instagram, Facebook, and YouTube. And our website is thetheroahospital.com for direct inquiries. Thank you so much for having me on the show.
Thank you to Dr. Abiola. Thank you also for listening this morning. Radio Doctor on Women Radio Wfm 91.7. It's Nigeria's first specialized radio health program, broadcast from Mondays through to Fridays at